I want good nutrition and quality sanitation for children in school.
I want children to have an opportunity to develop their talents.
I'd like to see children have a safe environment where they can play, both at home and at school, a place where they feel safe and protected.
I want children to have access to free health and nutrition services.
My aspirations for children is for children to be happy children, free from violence, poverty, and child labor.
I want to see children have access to a quality basic education and to have a happy childhood.
Save the Children's Ambition 2030 strategy is a really exciting step for the organisation. For the first time globally, all of the members, all of the country offices, regional offices have worked to develop a single strategy, a strategy that sets out our ambitions for children over the next 15 years and what we want to see achieved. I think we're absolutely committed to working with the most deprived children, making sure that every child in every context gets the right to a decent education, a good start in life, a healthy start, and freedom from violence, and making child protection a key priority for children globally.
I would wish for all children to have access to education and to opportunities to fulfill their dreams, whatever that might be.
My aspiration for all children in the world is for them to have proper nutrition and quality health care.
I wish for a world where all children feel safe and protected.
I would like to see children be children. Let them play.
I would like all kids to have access to the best education and the right to life.
I love to see children have time to play.
It's the first time that we've come together as a single organisation to do this, and it creates a really exciting framework for us to say we can't afford to leave a single child behind. We know that we've made huge advances in reducing the numbers of children dying preventable deaths over the last 20 years, but there are still unacceptably high numbers of children who are dying, unacceptably high numbers of children who are not getting to school. And we, as Save the Children, we need to be the organisation that is campaigning for the rights of the most deprived children who are living internationally. What does that mean for us here in Kenya? Well, we've put together again an extremely exciting 3-year strategy that will really focus in on the most deprived children, children living in the arid and semi-arid lands of the north, children in refugee camps, children who are living in informal urban settlements. We know in Kenya from the child rights situation analysis that we've done, from talking to other agencies and from our own work on the ground, we know that these are really the children who are being left behind in Kenya. These are the children who are not getting an equal chance to education, to health, to child protection and to other opportunities. So for Save the Children, over the next 3 years, these will be the children that we really focus on. These will be the children that we measure our progress and measure our impact by, because we sincerely believe that every child in Kenya should have the right to a good education, good health care, and freedom from violence.
My wish would be for children to be able to access free healthcare in the country.
Personally, I would like to see kids, especially who are able differently, or the kids who are physically challenged, access more facilities.
And also, if the government can actually put in more resources towards issues of education, issues of health, and issues of social protection.
I'm looking for a world in which children do not have to work. Children can play, they can interact with their age mates, and they can survive and learn.
In our Kenya strategy for the next 3 years, I hope you'll have had a chance to read the document that we put together. And we highlight in there 3 children who are really examples of what we're trying to achieve and the kinds of children we're trying to reach in our new strategy. So under child survival, we focus on a girl called Jennifer, a young baby who was born prematurely in the west of the country in Bungoma, who a few years ago, without Save the Children's intervention, probably would have died. She was born in a rural area and born underweight, born premature, and the facility she was born in even said that a few years ago, without the staff being trained, without the practice of kangaroo mother care, large numbers of children were dying, really preventable deaths. So when we think of child survival, when we think of maternal newborn health, that is a big part of our program in Kenya, I really encourage you to think of Jennifer. Think of the life that we have saved there, and that there are many more children like Jennifer whose lives we can save through our maternal newborn and child health work.
When a child, in my opinion, gets a good education, they're empowered and they have a good livelihood.
Especially the marginalized and most vulnerable.
I really wish children in informal settlements like Kibera to have quality basic education, like access to quality basic education, and also quality health services.
I'd like to see a Kenya where all kids have access to quality healthcare services.
What I wish for is that no child is at risk of violence or abuse in their homes and in the communities where they live.
I would wish a system that is able to respond to the basic needs for children.
I wish all the children in Kenya will have better access to education in the next 15 years.
I wish children will have access to good quality healthcare regardless of where they live in Kenya.
When it comes to learning, we give the example of Aule, who is a pastoralist child living in Turkana. His family are pastoralists, like many families in the north of the country. His siblings have gone to school, but he's not had the chance to go to school. And we want to really, again, focus on Aule as an example of a child who didn't have the best chance, didn't get a good education, and a child that we should be doing everything possible to encourage to get back to school, to work with his family, to work with the education authorities, to ensure that Aule can also get his right to education. And then when it comes to child protection, we use the example of Anfa. And Anfa was a girl, a Somali girl, who was separated from her family as she made her way from Somalia to escape the challenging situation in her home area, made her way to Dadaab, but had been separated from her family, like so many children in refugee camp settings. And through our child protection work, through our family tracing program in Dadaab, we were able to reunite Anfa with her sister, and really make sure that she was therefore back in a protective environment, back in a family environment, and in making sure that she was protected and that her family was reunited. This is just typical of the child protection work that we've been implementing in Dadaab now for many years, and something that we hope to expand on and improve on over the 3 years of the strategy. So when you think of our strategy, don't just look at the document itself. I really encourage you to think about the children that we are focusing in on. Jennifer, Aole, Anfa, these are the children whose lives we have changed, and there are many more children out there in Kenya whose lives that we want to bring about similar change in the next 3 years.
My wish or aspiration for all the children is for them to have something on the table, because when they get food, they are able to develop their brains and they'll be able to achieve their goals in life.
I would like to see all children of primary school going age attend school.
My aspiration for children is to have a world where they have access to basic education. They live to see their 5th birthday and have memorable childhood.
My aspiration for children is that they are participating in development, they grow to be healthy adults, and they have basic quality education.
I want to see my children live in a safer world.
I want every child to have access to good education.
My wish is for every child to be able to access quality education.
As for me, I would like every children's rights to be respected.
I would like a Kenya where children are respected as individuals and listened to when important decisions are being made.
I want all children to have access to good quality education.
I want all children to have access to better, improved healthcare services.
I'd like every single child in Kenya to have a healthy start to life and access to quality basic education. Survive. Learn. Be protected.
Survive, learn, be protected.
Survive, learn, be protected.
Survive, run, be protected.
Survive, learn, 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 be protected.